Thank you, Ginny. And what a great turnout. My goodness me. Primary care must have stopped today. You're all in. Right. So, the Topol review. I don't know if anybody's had the pleasure of reading it page to page, but it was released in February 2019, and it was actually quite a crucial report, really, in terms of making the case for digital education across the NHS, actually. So the guy that we had to carry out the review is a guy called Dr. Eric Topol, and the key thing was that he was requested to do it by the Secretary of State, and the key thing was that it was a very independent review. So in terms of the questions that Dr. Topol was asking, he firstly needed to ask about what were the likely technological developments that were going to change the roles of the NHS over the next 20 years? What were the implications of those changes in terms of skills? And then what did that mean in terms of how we educate our workforce? So, as with all these things, there's always some concerns around digital and about spreading digital. So he started with 3 principles. First of all, probably one of the most important things is that patients needed to be included in any rollout of digital, and that they needed to be really at the front end of any decisions that were made around what types of digital tools the NHS should be providing. There was also an acknowledgement that the healthcare workforce needs the time and also the evidence to be able to demonstrate that what they were going to be implementing were going to do the best things for patients. So a lot of the questions that we get asked when we go to NHS trusts is, where's the evidence, where's the cost saving? So it was really key that in order to push this stuff out, we needed to make sure that the healthcare workforce were really behind the work and the evidence that we were going to be pushing out. And then finally, the gift of time. So I think a lot of people obviously get a bit concerned about certain types of technology. AI in particular is one thing that really concerns people. So one of the key principles was to explain that actually, to implement these things would give professionals back the time that they needed to deliver services in a sort of compassionate and meaningful way. So in the review, Topol identified 10 different types of technologies that were most likely to have an impact on the NHS over the next 20 years. And as you can see, telemedicine, smartphone apps, sensors and wearables, all things that they think are significantly going to impact delivery. And of course, those top 3 as well are things that really do find their home within primary care and within community services. So, the summary findings. As you would expect, there was a real recognition that in order to make any of this stuff happen, we needed to give the workforce the time to actually attend these training sessions and to acquire the skills that they needed. There was also a need to make sure that we were able to get the leaders behind the activity as well, because I think, again, there's lots of people across the NHS trying to implement small pieces of technology in their particular clinical pathways or within their particular organisations. But what we've recognised is that in order to actually really push this stuff in a meaningful way, that leaders need to be really behind it. And then finally, that boards and kind of the leaders within different parts of the NHS needed to make sure that they had that compelling case and evidence for people to take on new technology. So the main recommendations seem to centre around education and training, as I say. So the initial next steps is that they're going to develop over the next year a really detailed plan around implementation of recommendations. But in essence, they wanted to develop a programme of digital education that spanned across the NHS. Make sure that at the same time the education that's provided is personalised enough for individual people's needs. And as I say, make sure that the people are given the time to actually train. And essentially try and create a cadre of skilled educators that could go around the NHS to spread the word and to champion. And then in terms of the next steps, they obviously also need to think about the future workforce. I think at the moment we have about 50% of the workforce that we're going to have in place in the next 20 years. So there's a big emphasis around working with schools, working with further education, and also working with kind of education providers to make sure that they're creating the right workforce for the future with the right digital skills. So that's Topol. And then what I also wanted to talk to you about today is what Eastern Academic Health Science Network can deliver for you. So we're funded by the NHS. We are one of 15 academic health science networks across the country. And our role is essentially to try and turn some of those great ideas, actually a lot of those great ideas come from clinicians as well, I should say, and sort of allied health professionals, but to try and turn those great ideas into positive health impact. So essentially we are catalysts for innovation. We connect partners, so obviously within the east of England we have a lot of networks that we create and bring people together. And essentially we're trying to create the right environments for change. So a lot of that requires things like making sure that people understand how they can implement new digital technologies and other types of pathway change through quality improvement methodologies and things like that. And obviously, most importantly, we're collaborators, so we tend to be behind the scenes supporting people to test new ideas. And our collective impact has been quite significant. We were set up back in 2013. These are a little out of date now, the statistics, but essentially we're working with lots and lots of innovators to get their ideas into the NHS. In particular, innovators tell us of all the sectors actually to try and infiltrate the NHS is the most difficult. And that's probably to do with the risk that's inherent in changing sort of pathways when you're dealing with human beings. But as you can see from the slide, we've had a significant impact in terms of patient benefits, also in terms of money. One of our roles is trying to stimulate growth within the economy around innovation. And we're working with lots and lots of different trusts, creating jobs and also supporting individual innovators. So this is our patch. So you're kind of on the edge of the patch, if I'm honest. So you have two academic health science networks. You have ourselves and then also UCL partners, work quite closely with some of the trusts in Essex. But we're very lucky with our region. I think there's lots of assets, probably more so than most other regions actually, especially in terms of things like life science, communities. We've got 15% of the total in the UK. We've also got a very static population as well, which is quite handy when you're trying to implement new innovations to be able to measure impact. And then obviously we've got world-class universities and research hubs. So we really do have all of the necessary ingredients that people need to create ideas and then to get them into a system. And then these are some of the things that I thought might be of most interest to you today in terms of understanding what support we can provide you in terms of workforce. So for example, we run the Medical Directors Masterclass. So that happens every couple of months and that's mainly actually for trusts, but there's no reason why we can't widen it out to leaders of other primary care, for example. But that's where we basically convene people to come together who I think probably in the past would have been drawn together through things like the SHA, but now kind of there's a bit of a gap. So we convene those individuals, provide them with sort of leadership support, and then they have a networking session at the end. We also run clinical entrepreneur forums. So again, as I said earlier, one of the key things that we've identified in terms of innovation in healthcare is that some of the best innovations come from clinicians and from people that are working on the front line as allied health professionals. So we run the forum. We also work around a network. So that's slightly different to the forum. The forum provides more kind of one-on-one support to clinicians with their ideas, but the network is more of a kind of learning space. We're also introducing something called Innovation Ambassadors, where we're part funding clinicians within different trusts to act as kind of a central referral point for innovators that wish to create or to promote their ideas. We've also run researcher sandpits. So we ran the first one last year, where we drew together academics from across the region, and then they submitted applications, and actually for the first one they managed to secure a grant worth 2.1 million. So what we're trying to do really is convene people in different ways to think slightly differently. We've also recognised the emergence of the primary care networks. So we've created sort of a package of support that's on offer, sort of detailed in this leaflet actually, but it's very much around what we can do in terms of trying to support you, particularly around the digital aspects of some of the work that you'll be doing to move your primary care network forward. We also run Future Tech Roadshows, which is just really a way of trying to spread the word around technology to the whole of the NHS workforce. And then the other thing that we do that's probably of interest is the innovation exchanges. So we're funded by the OLS to run local events where we identify a particular challenge. So our last one, for example, was around estates and facilities across the NHS. And then we bring together innovators and they basically pitch their wares, and we then seed fund particular organisations to then test out their innovations in real-time settings. Here's how you can contact us, and as I say, we're funded by the NHS, so a great deal of the stuff that we deliver is obviously free. So do get in touch, and as I say, we're particularly around the primary care network packages. If anybody wants any support around leadership or facilitation of things like visions and purposes and all that sort of stuff that you've got to be concentrating on over the next year, then do get in touch and we can help you, I'm sure. So thank you very much.